This video will be demonstrating the application of pit and fissure sealants on the model. Pit and fissure sealant is a primary preventive procedure which works by sealing off the deep pits and fissures which are prone to caries. It cuts off the bacteria from its nutrient source. It can be applied for both primary and permanent posteriors with deep pits and fissures which are not considered self-cleansable. The armamentarium required for sealant application are tweezer, mouth mirror, explorer, suction tip and cotton rolls for isolation, etchant, bonding agent, applicator tip, pit and fissure sealant, curing light and articulating paper. Coming to the stepwise clinical procedure for sealant application on tooth number 36. Primary step is thorough prophylaxis, following which a strict isolation using cotton rolls and suction has to be maintained throughout. For mandibular teeth, isolation using cotton roll can be done on the buccal and lingual side, whereas for the maxillary teeth, buccal side isolation is sufficient. The tooth surface needs to be etched with 37% orthophosphoric acid. The etching has to be done for a time period of 20 seconds, following which the tooth has to be rinsed and dried. After drying, we will be able to appreciate a white frosted appearance. Following this, the bonding agent has to be applied. There are two schools of thought regarding application of bonding agent. However, research shows improved retention of the sealant with the application of bonding agent. It has to be cured for 20 seconds. Following this, the sealant has to be applied. The sealant can be applied from the distal to the mesial end. Sealants have special superior flow characteristics owing to their less filler content. Care has to be taken to avoid any air entrapment. The sealant has to be cured for a time period of 40 seconds. We can verify the application of sealant using the explorer. We should also verify whether there are any high points or not with the help of an articulating paper. In case there are any high points, it can be removed with the help of a composite finishing burr. The patient has to be recalled after 3 or 6 months based on the level of caries risk. Thank you.